He lives on you, survives on you. So that's what the baby is. The baby must first of all take before you are settled. So for baby to lose, to have a challenge because you are not eating, it has to be over a very long period of time. That is why when you come to the hospital and you're not eating well, we know just from your urine, we can tell whether you have been eating well or not. All right? So you may not feel like, but you still have to feed because of who? Because of the baby. So that the baby can gain weight. All right? So the next slide, the height. You take your height. We don't expect your height to increase or decrease. But this is why we take body mass index, which is the next slide. Go to the next slide. So don't say, doctor, you mean my height is will be changing during pregnancy? No, you have attained your maximum height. The height you are before you got pregnant is the height you will be after you have what you have delivered. It may appear as if you got shorter during pregnancy. It's not your height that changed, it's your size. You know, there's a relationship between size and height. When somebody gets fatter, it may appear as if his height reduced. And if you reduce weight, it might look as if your height increased. But your height doesn't increase. Measure your weight vis-a-vis your height, because this is more predictive, more contains more details as it applies to your outcome in pregnancy than just your absolute weight. Because a woman who is tall, let's say a 6 feet woman who is tall and is overweight, it's not the same with a woman who is less than 6 feet and has the same weight in terms of your obstetric outcomes. All right? So that is why we use the weight over the meter square to be able to determine. So you have the normal BMI, which is 20 to 24. So how many of you know your BMI? Okay, only one person. Now switch. When they come, people don't tell them their BMI. They don't tell you, Abi? Okay, so please, when you go for your next antenatal, ask them to check your BMI for you. The normal is 20 to 24. 25 to 29 is regarded as overweight. 30 to 34 is regarded as what? As what? 35 and above is what? Morbidly obese. 15 to 19 is what? Underweight. And if you are less than 15, that means extreme, that means hunger is worrying that person. Starvation. There's a problem somewhere. All right? No pregnant woman should ever be 15 and below. Even 15 to 19, you have to start asking. All right? So please, when you come for your next antenatal, please check your BMI. Okay? And if it's between 20 to 24, if it's between 25 to 29, overweight, it's okay. Nothing to worry about. But if it's 30 to 34, by just looking at, come and use your eyes to calculate and see whether there's anybody that falls at that 30 to 34. There's nobody. Come and stand there and check them out. One by one. Maybe some people are even less than that 20 to even 24 self. 20 to 24 is good. 25 to 29, not so bad. You can't be checking from behind now. Is it from behind you check? Come and stand here and check. Just examine your eyes and ask. Why are you keeping it to yourself? Exactly. 20 to 24. Okay. What about my sister over there? Why are you laughing? Okay, go and sit down. Go and sit down. Ah! But it's good for you to know your BMI. Okay. But even doctor, what do I do? I should stop eating. I've not said so. Eat. Hmm? In moderation. All right. You don't you don't start losing weight when you are pregnant. You lose weight after you have delivered. Okay? So when patients say, "Oh, I'm watching my diet. I don't want my baby to be too big so that I can push it out easily." I don't know if you have heard that before. Big, big people deliver big things. You understand that? If you are big, you give birth to something that is big. If you are small, you give birth to something that is what? People don't eat well while they are pregnant. So the baby is just manage. You know when you go for is different from just one. When you go for buffet, you eat assorted variety. Different things come in. But if it's just one meal, that's all you get. I'm sure we understand. So eat well, make sure your baby gets the required nutrients, and the baby will grow. But of course, like I said the major thing that determines your weight is the genetics. All right, so next slide. So urinalysis. This is very, 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 very important science. And then we'll continue next time. But it's very important that we understand these things so that you're able to very, very, very important. When you pass urine for nitrites, check for what they call urodynanogen, that your blood is being broken down. They check what else do you check? They check for ascorbic acid, they check for um, ketones, right? That is how we know when someone is not eating well. When you come and they check your urine and there are a lot of ketones. Ketones are broke down products of fats. It means that you've not been eating well, so the body is now breaking down stored fats and to use it as energy. So when you come and you pass urine, you see a lot of ketones. And like if your your urine has glucose, it means that if not invariably, it could suggest that your blood sugar level is high. And so you need to do your blood sugar test. And for patients who are not diabetic, it could be strongly suggestive of a gestational diabetes or gestational glucose intolerance. And so we need to take you through the blood test to ensure that all is well. And if you are a known diabetic, of course, it means that your blood sugar control is not very tight because pregnancy can affect the control of your blood sugar. All right? And then when you check your urine, and the urine is the urine has protein. Protein could mean that you're having what we call preeclampsia, in which case your blood pressure is high. Once you have high blood pressure and protein in your urine, it means that you have preeclampsia. And this is one of the pregnancy-induced conditions in pregnancy, I mean, hypertensive disorders in pregnancy that, if not well managed, can actually affect outcome. It could also tell that you're having a renal disease. Your kidneys are being affected. It can also suggest that you have an infection a urinary tract infection. So you can see that there are so many things that these things present in your urine can detect. And of course, if you have nitrite, it also would suggest that there is urinary tract infection. So I've talked about ketones. It means that you exclude hunger, starvation, and for someone who has not been eating well because of hyperemesis gravidarum. Next slide. Okay, so I've talked about nitrite, urobinogens to exclude breakdown of your red blood cells, and leukocytes to exclude infection. Okay, so we'll take one or two more slides and then we'll end for today. So after you have done all of this, then your first booking clinic. Next slide. So you have a deep meditation is done. For most of our patients here who went through our IVF program, that was done at your first consultation with the fertility specialist. So it included your bowel data, obstetric history, gynae history, and medical history. So in your bowel data, as usual, it includes your age, all right, your age. I know some of you are working in the civil service, you change your age. But when you're coming to see your doctor, give us your real age. I beg you. Don't give us your official age. Give your real age. Give your real age, not your official age. Uh-huh. Give your official age. It's very important. A lot of things we do, age is what we do. All right? And then obstetric history. The reason why obstetric history is very important because we want to know what your past obstetric history is like. For example, someone who has had a previous delivery, you've had one successful delivery. It's not the same with someone who is not pregnant, who has not been pregnant before and is just pregnant for the first time. The risk associated with those pregnancies are different. That is why primigravidas are regarded as high risk pregnancies, while uh, patients who have had regarded as what? As low risk. A woman who has had a cesarean section before and is now pregnant, the woman who had a successful vaginal birth and a cesarean section has a scar in her womb. And how she performs during that period and the delivery process itself and the decision as to how she delivers are all going to be determined by her obstetric history. All right? And that also goes for gynae history, a medical history, surgical history. A patient who has had a previous myomectomy and is now pregnant, it's not the same with someone who has never had surgery before. That is why all of these histories are all very important. And then your medical history. Are you hypertensive? Are you diabetic? Tell us. Don't say, oh, they told me before that my blood pressure was high, but I'm not taking any medication. The fact your vitals is what is mandatory. There are a lot of our patients who we see after they've done their vitals. That is when they are knowing that, oh, my blood pressure is this high, because they don't check. All right. Once you come into that productive age group, you must ensure that. And so, um, diabetes mellitus is also very important. So that's why you want to know whether whether you've been diagnosed before with a history of diabetes mellitus. All right. Asthma is also part of what we look at. All of those medical histories, we want to consider them. Okay. Next slide. So surgical history, I've talked about the surgical history. I've talked about the family and social history. You want to find out if there's any family history of hypertension, of diabetes, right? Anything that could you know, suggest a familiar disease so that the team will be aware of. And then social history. You drink alcohol a lot. And women smoke too. I'm not feeling that women smoke. Although in this part of the world, we don't have it so much. Our women are very cultured and they tend to be very, you know, they're not that as wide as women in the other part of the world, other cultures. But in other cultures, a lot of women smoke and take a lot of alcohol. And these things affect pregnancy. It affects the baby. All right. So while we ask those questions, we know that most times the response will be, you take alcohol? No. You smoke? Uh-uh. They had to look at it. They had to look at the doctor like, doctor, are you for real? Are you asking me? Of course not. Please pardon us. It's part of the routine questions we must ask. Because some women smoke. And if you don't get that history, okay, and they continue, the baby will come out, you know, affected. So that is why we ask all of those histories. Whether there's history of, and then hard drugs. Some people take cocaine. Yes. So we ask all of those questions just to be sure that we pick up any red flags. Okay? And then we ask about your drug history. Some patients are on certain kind of drugs. So we want to ask, are you on any drug? But there are some drugs you take that will reveal a disease condition that we didn't ask about. Oh, are you on a drug? Oh yes, I'm taking levothyroxine. Oh, you have a thyroid? Oh yes, yes. But you didn't ask. And that can affect. So that's why we ask about drugs. What are the drugs you're taking? And some women may be taking some drugs that are not good during pregnancy. You're taking some antihypertensive medications that you're not supposed to take, and you just continued while you were pregnant. That is why when you come for your first booking visit, you must declare everything. You know, when you are traveling to the States, you know, they give you a form to fill to declare different things. If you are carrying certain amount of money beyond, you declare. If you are carrying foods, there's any kind of food. No, Nigerians, we like to carry food when we are traveling. Hey, as if they don't carry that food, they will not survive. So you have to declare certain things. So it's very important when you come to see your doctor, you declare all the medications you are on and what you are taking. You never can tell. It could just be important to your care. And then lastly, under um, the booking history is your detailed physical examination after you are done with your history taking. So we want to examine you to check through a general physical examination. Then we examine the different parts of the body to ensure that everything is fine. And then lastly, we do a transvaginal scan. Vaginal scan. You know, in some other centers, they may ask you to go and do a scan at a certain age of pregnancy. But because we have the scan machines in our offices, it's part of the care we give when we are doing um, your your examination. For each visit you come, you have a scan done at no additional cost. You should. Ah, I said no additional cost. All right. So you have a detailed. So you have the next slide. So you have a scan done, and each time you come for your antenatal, you have a scan done to check how your baby is doing. Now, talking about scan, we also want to introduce a 4D scan. All right. How many of you would like to see your baby in 4 dimensions? Like a picture, not the 2 dimension. Yeah. Terms and conditions apply, so you know. All right, so that is part of what we're going to be offering. Okay. Yes, you see your baby in the real version. You know what? You know when we are doing scan, it's only the doctor that sees what he's seeing. Abi? The patient is pretending to see what the doctor is seeing, but we know that the patient is not really seeing exactly, not understanding. But when it's a 4D scan, you get to see um, real, the real deal. So that will be done. Yes, 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 yes. And then after that, you go for your blood test. There are routine blood tests that you must do while you're pregnant. Some of them we already have done while you were doing your fertility treatment. All right, and others will have to do. But basically, it's your blood group, genotype, serology, and then your full blood count. All right, and then you get your medications. So for medications, patients who are with us here, they get to use more additional medication because of the fact that most of them do that backlash, and so they are on the the, the Clovina, they are on the tocolytics, salbutamol or nifedipine, just to keep the use of five. But basically, for pregnancy, all you need as medication are your routine hematinics that contains iron and folic acid, basically. Every other thing is Jara, uh, vitamins, multivitamin. Uh, and based on your hematinics, they have class. They have class. People in certain class use certain kind of medicine. Those in other classes use for that class because pregnant care have class. There are some class of pregnant care that are very expensive. Are used by certain class of people. I'm not if you understand. Uh, but basically, all of them, all you need is iron and folic acid, essential. All the other things, if you are eating well, no, there's some people that know how to eat well. How many of us are there? Ah, when you watch some people eat, my God. ah, some people they know how to eat very well, and I like that. Food eating well is good. Hmm? It's good because there is no defense like natural defense. Do you understand what I'm saying? There is no defense like natural defense. There are people who hardly get sick. First of all, it's God. We acknowledge that. But secondly, they also how they take care of themselves. Do you understand what I'm saying? How they take care of themselves. So even in pregnancy too, how do you explain a woman who goes, I was very busy. I mean, like that as a routine. No, no. Yes, we say that your body breaks down what is stored, but that is not the ideal. Hmm? Even if it is not flowing, just take something small. Hmm? Take something small. It's better for a woman to be taking bit by bit than to not just take anything. You are now asked to pick up your medications, and then you make sure you book your next appointment. Don't remember your appointments, your visits are appointment based. If you don't schedule an appointment, the front desk will not know when to call you because there was no appointment booked. But if you book an appointment, when that day is approaching, I think what they do, Nurse Rachel, a day before, they send a reminder, right? Exactly. And sometimes even on that day, they will send you a reminder. So please make sure you book your appointments. So on this note, we want to end it here, and then we will continue next time, next month. Please don't miss it. We'll take the part 2 of our antenatal class at the Joje Center for Women's Health. Any question? Yes, please. Preeclampsia. Yes. Very good, very good. Thank you very much for that question. Okay, so when we say someone has preeclampsia, we say that he has elevated blood pressure and then there's protein in the urine. Those essentially are the two parameters that you need to use to diagnose preeclampsia. If it's just elevated blood pressure, you say, and this patient has never been hypertensive before, you say she has pregnancy-induced hypertension. And if, in addition to that, she has protein in her urine as determined by the urinalysis that will show the severity, whether it is 1 plus, 2 plus, or 3 plus, and you say she has preeclampsia. Now, if it's 3 pluses, that is severe preeclampsia, particularly when the blood pressure is above one that becomes something you need to be worried about. That patient needs to be admitted in the hospital and managed. If not, from preeclampsia, you can enter what? Eclampsia. Eclampsia means a woman who fits, who has a convulsion while she is pregnant. Some women have that. From there, they transit. Some women have that and they have long-term sequelae. So it's not a condition that any woman should have. In fact, it is said that if a woman has developed eclampsia while she is pregnant, it's an indictment on the hospital if she was having antenatal care. If she was not having antenatal care, that was one of the major reasons why she should have been having, because there was that risk of having such once a woman is pregnant. All right. So now there's other symptoms that can come. Leg swelling can be associated with it. However, leg swelling is on its own is a normal phenomenon. So when a woman has swollen legs, what we want to check is to find out, is her blood pressure high? If the answer is no, cool. Does she have protein in her urine? No. So cool. So she can have pedal edema, which, and in fact, we say that it's doing well. So it's not a source of worry. Please, if you have edema in your legs, sometimes start looking for medication to take to dry it. It is normal. Don't go and start looking for massage. You want to massage your leg so that the thing will disappear. Normal. All you do is to just elevate your legs, put it on top of the pillow while you are lying down or sitting, and it will. Or if it's that bad, get pressure stockings. You know pressure stockings? You wear it and it helps to help the flow of blood back to the heart. All right? So that is why when you come for your antenatal, we check those parameters to be sure that you don't have preeclampsia. So when it becomes very severe, some people can start having headaches, blurred vision. Once you start having constant headache, your vision begins to get blurred, and we've told you before that your blood pressure is like this, that is an ominous sign. It could mean that you're just about to. So that is why now I'm not saying, let me balance what I'm saying now. I'm not saying that once you just have headache, it means that doctor said that means I'm about to fit. I have not said so. All right, because headache can be caused by so many other things. But if you have blood pressure issues, then you should be very concerned. There are a lot of people that have blood pressure issues. One of the ways they know that blood pressure is high is when they begin to feel what? Begin to have headaches. So you know how it does you. Some people don't have anything at all. Again, that you must also realize. The fact that nothing is doing you does not mean that there is no issue. That is why you must be checking your blood pressure. Okay? And the 2 weeks or 3 weeks we see you is good enough to ensure that we check your blood pressure and ensure that all is well. All right? Question? Yes, please. Very important question. Mm. Because that kind of thing that can cause family problems. When you put a ban, doctors who have gone through a lot too. How can doctor put a ban that me, I cannot access my wife? There's a blockade. No. But truly, because all we're doing is to take the necessary precautions. Once a woman has a cervical surgery, we say for the next 2 to 3 months, nothing. There's a ban. Men in the house, sorry. But you see, it's no. Let's look at it very critically. I'm sure the men will do anything just to safeguard what God has done. True? So the cervical stitch is an external body. You don't want to start irritating that place because some semen can contain infection. Some semen contain prostaglandins. All right, so it's just for out of the abundance of caution to say, please, just allow for about 2 to 3 months. That will take the woman to how many months? She was already 13 weeks, 3 months. So if you now, and before that time there was a ban already. Hey, Jesus Christ. Okay. So there was already a ban. So the ban is now extended for another 2 to 3 months. Till 6 months, right? And after 6 months, the woman is like, she's not her composure and position and state. Even the man will be running. So invariably, we are saying that this ban is for. Hey. No, it's not even 9 months. 9 months is the delivery. And after delivery, you have to still give like. Hi. That's serious. Trouble. Hey. No, but the men in the house, are we able to cope? Are we able to handle it? Someone is saying, we can do all things. Huh? We can do all things. But basically, after 5, 6 months, yes, you can. But see, the other thing is this. I once had a patient who was about 14 weeks. I just had a cervical sacrilege. And then they made love. And thereafter, the woman started leaking. She lost that pregnancy. Now, it's possible that maybe if they didn't meet, nothing happened. It's also possible that something could have happened, right? But I can tell you that woman will blame that man. You couldn't keep yourself. See now. And the man will blame himself. And he will carry that guilt for a long time. So what are we saying? So that we don't hear stories that touches the heart. Just try and maintain. Okay? Straight to the point. Nail on the head. Dr. Ini, come answer that question. You can. Huh? The potash is the main thing. Yeah, come and answer. Mhm. Ah! Oh, you not taking bitter leaf before? Why? Okay, so ewedu. You're not taking ewedu. Why? Oh, okay. Okay, so okay, see, wait. Okay, wow. Hmm. Hmm. Mm-hmm. Hmm. Okay, that's why she's the one. She said she want that can answer that question, Abi. Okay. Okay, so see, when it comes, hmm? That's why you will notice that there are different. Clearly say, I first leave. Okay, I'm not pregnant, Abi. What is the other hand? Ewedu. You read it? Careful. Friday, actually. Someone is thinking, should I have this question? Ask. All right, to ensure that everything is well. But basically, most of those multivitamins, they all contain actually the same. Some other things, calcium, omega 3. What you need is the iron. Any. Oh, online questions. Okay, so let's take the physical one there. Currently, you are physically constipated. Yeah. See, and unfortunately, when they get pregnant, pregnancy makes it worse, really. So, what we do is to say you have to be very intentional in terms of the amount of water you take, vegetables, fibers, and all of those stuff. So it's just to make sure that you are able to pass um, your bowel easily. But sometimes have such challenge.